Hello everybody, and welcome to yet another exciting episode of Medpack Monday on Toochibe TV. My name is Toochi Ibe and I'll be your host for today. In today's episode of Medpack Monday on Toochibe TV, we will be talking about peptic ulcer. When some people hear the word ulcer, what comes to their mind is something happening in the stomach. Ulcer goes beyond the stomach. An ulcer can simply be explained as an injury on the internal or external surface of the body that has failed to heal. Now, it can be found on the lips, in the mouth, on the skin, in the stomach, which brings us to what we're going to be talking about today, which is the peptic ulcer. Now, the peptic ulcer could either be a duodenal ulcer or a gastric ulcer. A duodenal ulcer is ulcer that is found in the duodenum, which is the first part of the small intestine, and the gastric ulcer is ulcer that is found in the stomach. So either of these or the both of them together are called peptic ulcer. Now we're going to be taking a few questions that are going to help us understand how this peptic ulcer occurs and give us more knowledge about it. Now the first question we have here is, can I get ulcer only from staying hungry? Well, staying hungry doesn't guarantee that you're going to have ulcers. Some people stay hungry and they don't develop ulcers at all. Now, what will make one develop ulcer is excessive use of non-steroidal anti-inflammatory drugs, which you can shorten to NSAIDs. For example, we have the aspirin, ibuprofen, diclofenac. These are examples of NSAIDs, and people that use them mostly for long are people that probably are treating arthritis or any kind of pain that has stayed for long. Now, someone can also get ulcer from poor hygiene. Yes, I said it. Poor hygiene. This is because ulcer is also caused by a bacteria called Helicobacter pylori, which can be shortened as H. pylori. So poor hygiene, you can get these bacteria into your digestive system, maybe from not well washed hands, from not well washed fruits or poorly prepared food, and they get into our body system from the digestive tract. Now, you can also find ulcer in patients who are suffering from certain diseases. For instance, there's a disease called the Zollinger-Ellison syndrome, whereby there are tumors that are in the stomach that tend to produce excessive amounts of gastric acid, and this gastric acid tends to injure the inner part of the stomach, the inner lining of the stomach. Now, there's also another disease called Crohn's disease. In Crohn's disease, ulcer, peptic ulcer, is one of the symptoms, one of the things that are one of the things that are seen in that Crohn's disease. Another way is if you have a family history of ulcer, there is a very high likelihood that is likely going to affect you. Probably lifestyle or different hereditary patterns have shown that people that have parents or siblings with ulcer also develop ulcers too. Excessive use of alcohol and smoking, these two things expose the inner lining of the stomach, and the gastric acid tends to now start digesting the lining of itself, of the stomach itself. So these things I've mentioned are the things that are likely going to cause someone to have ulcer. Apart from heartburn, what other symptoms are experienced in ulcer? Yes, heartburn is when people feel like, they feel hot here, Most people that have ulcer have that symptom, and it's called heartburn. Then another symptom that they can feel is a discomfort or pain in the epigastrium, this part of the stomach where your ribs end and the next part is your abdomen. There's a part that is up here that is called the epigastrium. People with ulcer have discomfort and pain there, and if you press it, and the pain is much more severe. So these are a few of the symptoms that someone can see in a patient that has ulcer. In people that have ulcer, sometimes depending on how serious it is, they tend to vomit and there is blood in their vomitus. So it's a sign that there is an internal bleeding in the stomach itself. Then they also have sometimes what is called the night pain. In night pain, the patient wakes up at night feeling very uncomfortable with so much pain, rolling and all that. That is called night pain. This is because this night pain mechanism works this way. At night, the pH, which is the acidity level of the stomach, is higher at night. So once the acidity level of the stomach is high, the ulcer, the part of the stomach or the duodenum that has this ulcer gets irritated, and this pain wakes the patient up from sleep, and then the patient is now rolling and is in severe pains. Another symptom that is seen in ulcer is what we call is dark stool. The patient tends to have feces that are dark colored. We call it melina. Okay, now what causes their stool to be dark is because the bleeding that has occurred has gone through the small intestine, then the large intestine, then all the way, and by the time it's coming out as feces, the blood that was in the stomach has gone through a lot of processes and chemicals and has now made the stool to become dark. Now, another symptom that is seen in peptic ulcer is what we call the acid rash. Here, the patient tends to feel some stomach juices coming out to the patient's mouth and mixing with the saliva, or it's almost sometimes there's also what we call water brush. It's from the esophagus when the esophagus is not very competent, so the fluids from the stomach just tends to come out to the mouth and has a little kind of sour taste. So that is what we call the acid brush, or when it's water, is now water brush. Does ulcer pain come only when there is no food in the stomach? Now, depending on the type of ulcer, in gastric ulcer, when there is food in the stomach, there is pain because the food irritates the ulcerated part of the stomach, the part of the stomach that has the ulcer, the sore. Once food touches it, it becomes very uncomfortable for the person. Whereas in duodenal ulcer, when the patient doesn't have food in his or her stomach, the patient tends to start getting uncomfortable, and the patient wants to just eat and eat and eat, and in order to reduce the pain that he or she is feeling. So it doesn't always occur when ulcer pain doesn't always occur when there's no food in the stomach. When there's no food in the stomach and the pain occurs, this is likely going to be a duodenal ulcer we are dealing with. But once the patient eats food, and at that point, that's where the pain is excruciating and is so bad. This means that we're now dealing with a gastric ulcer. Are there things that increase the risk of me getting ulcer? Yes, just like we mentioned, the causes of ulcer, those are also the things that will increase your likelihood of getting ulcer. For instance, excessive use of non-steroidal anti-inflammatory drugs like the ibuprofen, aspirin, then excessive smoking and intake of alcohol, then poor hygiene, then also if one has a relative, a direct family member that has ulcer, there's a risk of there's a possibility and likelihood of that person also getting ulcer as well. Are there things that worsen the symptoms of ulcer? Yes, there are a few things that worsen the symptoms of ulcer. It just depends on the individual also. If it's a patient that has gastric ulcer, eating makes them feel worse. Then if they even vomit the food, they feel much better. Whereas staying hungry makes a patient that has duodenal ulcer have worse symptoms. Then when also there is excessive alcohol, or the patient starts to smoke, those things will increase and worsen the symptoms. And then when the patient makes use of non-steroid NSAIDs, like we said earlier, and then certain foods that are high in acid content, and fruits also that are high in acid content, like the citrus fruits, like the oranges. Those fruits make the symptoms of ulcer worse. Why do some patients feel pain at their back while others don't feel pain? Some patients feel the ulcer pain here, and they also feel it at their back too, and the pain radiates to the back. Now this is because the ulcer pain that is felt at the back indicates that the ulcer is on the posterior wall of the duodenum or of the stomach, the wall that is closer to your back. That's where the ulcer is. So in patients that don't feel it at the back, most times the ulcer is not on the posterior wall. There are also some diseases that also makes one feel pain at the back, which are when you have a problem with your pancreas or sometimes the gallbladder. The pain can also radiate to the back. So it's not only in ulcer that yes, pain that's epigastric pain that radiates to the back. Now the next question, what drugs can be taken to treat peptic ulcer? Well, the best drug is the one that is prescribed by your doctor. The doctor will have to see you and assess from the history you're going to give and know the best treatment to give you. Usually there is antacids. They are usually giving antacids because antacids help to neutralize the acidity of the stomach. So when there is this discomfort, the patient can get a better feeling by taking antacids. There are also some drugs that help in the treatment of ulcer, which are proton pump inhibitors. Example, we have that omeprazole, lansoprazole. Then there are the H2 blockers. These two drugs, these proton pump inhibitors, the PPIs, and the H2 blockers, they help in inhibiting gastric acid production. Antacids reduce the absorption of H2 blockers and must be taken at least 2 hours apart if they are to be administered together. So in practice, the doctor is the best person that's going to show you or let you know the kind of drugs that are going to be best for you to treat ulcers. Now, what would somebody say now that is a diagnosis for ulcer? The best way is still with the doctor. Once the doctor says that you have ulcer, is a sign that you have ulcer. So, but then, if someone presents with the symptoms we mentioned earlier, epigastric pain and discomfort, and vomiting that contains some streaks of blood, malignant stool, and those symptoms that are typical of peptic ulcer, and then some investigations in the lab are done, probably a positive test for H. pylori, meaning that the patient, they are going to find the bacteria H. pylori, or the patient does an X-ray with barium swallow, whereby the patient is going to take a chemical which is called the barium meal, and there's going to be an X-ray done which is going to check for those, and then an endoscopy is done. So either of these investigations, together with the symptoms that are presented, will now know whether this patient has been diagnosed with peptic ulcer or not. So now, with these few questions and answers that we have given, we are sure that you have gotten something new in today's episode of Mefa Monday on Toochibe TV. Meaning that you know what causes ulcer, and you now know that you need to start avoiding them, and you know the things that aggravate them, and you need to run away from them. And then, if you're having some of these symptoms, it's best for you to go to the hospital and see a doctor so that a proper assessment is going to be done and you're going to be fine in no time. So thank you very much for watching up to this extent. I'm very glad that you have followed to this point. So if this is the first time of watching us on YouTube, please subscribe to our YouTube channel. We'll be happy to see that subscribe on your screen. So just click on the subscribe button right now, and then free. You'll be subscribed to see future episodes of our Method Monday series on Toochibe TV. So till then, see you next time. Stay happy and stay healthy. Bye.